Hello everyone. Today we will discuss about growth chart, its uses and causes of growth failure. This is a quite important topic in both community medicine as well as pediatrics. And any MBBS doctor, not necessarily an MBBS doctor, even an Anganwadi worker, is supposed to be trained how to mark things in growth chart, how to interpret growth chart, and how to visualize things. So we will go for it. It is a graphical tool to monitor physical growth of a children, wherein the x-axis represent age in months or years, y-axis the growth parameters like weight, height, head circumference, or BMI. The reference is usually in percentiles or standard deviations in lines, and there are different types of growth charts like WHO growth chart, CDC growth chart, IAP growth chart. In India, we commonly use IAP growth charts. So the types of growth chart: weight for age, this is usually for underweight; height for age for stunting; weight for a height for wasting; then head circumference for age for microcephaly or macrocephaly; BMI for age for overweight or obesity. So growth charts by age and ethnicity. The WHO growth chart are the standard ones which we tend to use for 0 to 5 years. That is typically in Anganwadi children. It is based on international multi-ethnic sample under optimal conditions. WHO growth chart is also there for 5 to 19 years. It provides a BMI for age and height for age references. And now IAP growth chart is available for modified to reflect Indian children's growth patterns. So this is how a normal growth chart will be. So blue color indicate for boys and pink color for girls. Here, whenever the growth chart there is a marking in green color, it means normal. If it is in yellow zone, a child can slip anyway. And if it is in case of red color, the child needs to be referred and treated by or at least seen by a physician. So if we can see, this is weight for age. So usually since it is for birth to 6 years, you can see almost 60 months. Okay, so there will be total of 1 year, 2 year, 3 year, 4 year, 5 year. And here there you will see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 11, 12. Okay. So the important point you need to make is there is no reason to make the diagnosis of, let's say, underweight or stunting or wasting by a single definition or a single indicator. For example, let's say suppose the child is in this grade, 2.5-year-old child is marked here. Yes, we can definitely say this child needs a referral. If suppose the child is here, doesn't mean that necessarily the child needs to be normal, because growth chart we are just seeing a snapshot. Okay, so for a child to be declared in red zone and need a referral, a single marking is sufficient. As far as the child to be declared normal, see, at least we need two markings. So let's say the child can be here, but previously it would have been here. The growth has been decelerating, which we might not be aware of. Or the child might be here, but previously the child was here. So in general, what we tend to do is we at least do serial markings in such a to determine the growth of the children. Okay, now the uses of growth chart. It detects the growth problems early. And remember, it is a routine monitoring. This is done for all the 0 to 5 year age group children in Anganwadi centers. It detects the growth problems early, assess the nutritional status like underweight, stunting, wasting, obesity, identify systemic diseases, monitors the effect of therapy, counseling tool for parents too, and it is a public health and useful for research also. The causes of growth failure include nutritional causes, chronic systemic disease, and endocrine causes. Nutrition causes may be due to inadequate intake, poor quality diet, or malabsorption. Systemic diseases like heart issues, kidney issues, liver, lung, or TB or HIV kind of diseases can cause. Endocrine issues like hypothyroidism, growth hormone deficiency, diabetes, rickets can also cause such things. Causes of genetical or congenital include Down syndrome, Turner's or skeletal dysplasia, psychosocial factors like neglect, deprivation, or parental illness, and recurrent injections and drug effects also can cause growth failure. So, clinical importance: weight faltering precedes height faltering. So, usually weight signifies there is an acute issue with the condition, and height indicates it is a chronic condition. So, usually there will be deceleration of weight before the height. So serial monitoring is the key, and single measurement is always misleading. Red flag signs include a dropping of 2 percentile lines, height below third percentile, and no gain in 6 months. So growth chart is a simple yet powerful tool, reflects nutrition, health, and well-being, helps in early detection of growth failure, guides timely intervention to prevent long-term complication. So I hope you have learned from this presentation. Thank you for watching.